Hey everybody, Nettie Owens here with Sapari Solutions, and we're continuing on the discussion of what businesses need to know right now. I'm happy to bring you Dr. E today. He is the physician who helps physicians. So this is a great conversation to be having right now, especially with what's going on in the world. Welcome to the show.
Hey, Nettie, thank you for having me.
Absolutely. Actually, I'm really thrilled. I'm excited just to hear what you have to say and where this conversation is going to go. But just to give everyone here an idea of who you are, Dr. E coaches doctors in business and entrepreneurship. He believes that physician entrepreneurship is the way to fix the health crisis by returning the business of healthcare to those who care for patients, which I think is a great idea. And I want to just put a plug here. We did an interview a few months back on my podcast, and I would recommend everybody go listen to that. You've got to hear Dr. E's story. It's quite fantastic. And there's going to be ways to get in touch with him at the end of our conversation here. So without further ado, I'd love to just jump right in here and get your take from a doctor's perspective of how long do you think things are going to take to go back to normal from your perspective and for doctors' practices. I mean, things I know for myself personally, all appointments are via telemedicine and it's really just limited to absolute necessity. So what's it going to take to be back in the doctor's office?
Well, I think the most important thing to understand right now is that this has acted as a catalyst. I think we're going to look back at this at around this time, and we're going to remember of how things were before COVID and after COVID, and it's going to be totally like a very clear distinction before and after. I don't think we're going back to normal. We will eventually develop a new normal that we'll get used to, but things won't go back to being the same they were before. I mean, when you think about 9/11, for instance, we never went back to how things were before in terms of travel, right?
Mm-hmm.
People were expecting, it's going to streamline. Like, no, now we have all these new security measures that we've gotten used to over the last 20 years, but that didn't exist before, and it's going to be very similar afterwards. And I think that a lot of the doctors that are just waiting to weather the storm and then hoping that things are going to go back to normal, they're going to be woken up by a very harsh reality, because there's a lot of things that they need to be doing to adapt their practices, and it goes beyond just offering Zoom video consultations with their patients.
Well, what do you think some of those adaptations will need to be? I mean, I've seen the telemedicine. I'm in Pittsburgh, Pennsylvania, and the healthcare provider that I use actually already had like an online portal and some of these other things. It seems like it was fairly seamless to move into this, but I imagine that's not necessarily the case for, especially a small family practice. You know, they didn't necessarily have that set up. What do doctors need to adjust for?
Well, I actually think that the small family practices are the ones that are better suited to pivot.
Okay.
You know, it's a lot easier for them to implement these very big changes and start pivoting. When most people think about telehealth and even physicians, they think that it's just, okay, instead of sitting in front of my patient, I'm going to be doing it via Zoom. And a lot of doctors are still thinking, you know what? I won't be able to provide all of my services via telehealth because I'm used to doing this, I'm used to doing that. But the thing that we need to be mindful about is that this is just the beginning. This has been the catalyst. A lot of regulations that were in place have been removed. A lot of red tape has been removed. And I think this is going to open the door for a lot of new devices, a lot of new technologies to be developed. So we're going to start seeing a lot of remote diagnostic devices that people will either have at home or that will be able to be deployed to their homes. And for instance, if you have kids, you will not have to go to a doctor's office anymore. Because you'll be able to do all your consultation.
While I get a box of chocolate and send it to you, because that sounds amazing.
Well, I mean, think about it. If you've got, because we've got a 2.5-year-old, right? And when he's sick, he has been sick like once or twice. But the last thing you want to do at that time is to put him in a car, in an uncomfortable chair, drive him across town, be in traffic while he's feeling ill, and sit in a waiting room full of
With
other
other
sick
sick
kids.
kids.
So
I know, yeah.
wouldn't it be great if you had a little device that could either plug into your phone or that you could have at home that will give your doctor real-time clinical data, temperature, vital signs, all these different pieces of information that he or she needs to make a diagnosis and prescribe a treatment?
Well,
Because that's
pretty
really
close to some of that with, with smartwatches and things like that already
exactly.
do a lot of that tracking. So now it's just a matter of connecting that information and making sure the right people get it. I know when a few weeks back, there was an article in the New York Times and an op-ed that talked about, pulse ox as one way to measure if someone has coronavirus, or one thing to look for. And of course, pulse ox machines flew off the shelf, but my daughter had a watch that measured oxygen level, and it was like, oh, cool, we've already got something in place. So that's a really good point, and something that that doctors can be thinking about now is like how to tap into the technology that already exists, or what gaps could be filled.
How to be prepared to start leveraging this technology. We need to remember that technology is advancing at a much more rapid pace than we used to think before. When the internet first came out, it took 10, 15, 20 years for it to get to the point that we were right now. But the innovation that we're going to see in the next 2 years is going to be much more than the one we saw in the last 20 years. So people are thinking, yeah, these devices, maybe in 10 years. No. Maybe in a year and a half. The technology exists. The ability to develop these devices exists. The reason they haven't been developed is because there was so much red tape in the healthcare industry that the manufacturers and the developers were just not interested in going into that business.
Right.
But it exists. I mean, if we've got the cell phones doing the stuff that they're doing, we've got Elon Musk sending electric cars to the Mars. Don't you think we can do these things?
Conversation.
And the doctors that are going to be the best positioned are the ones that are actually considering this and setting themselves up right now so that when that's available, they're well positioned.
Do you have clients of yours that are starting to move in that direction? And what are they doing, or what would you recommend that others do differently to kind of stay ahead of this pack?
So the most important thing that I'm recommending a lot of my clients, and of course you really cannot know specifically which direction it's going, but what we're actually starting to see and what we're actually starting to recommend is for them to start really creating their own personal brand and to start educating patients and potential patients. Because once this happens, it's literally going to open up the floodgates in the market for worldwide exposure. And now it's going to be just as simple. Now you no longer have to compete just with the doctors in your city or in your zip code. Now you're literally competing with the rest of the doctors around the country. So the doctors are the practice is that right now, spend the time and the effort to build a solid personal brand or a practice brand and start educating people and start bringing value to them, despite them not being able to be their patients right now. In 5 years, when a patient in New York is able to telecommute or to televisit a doctor in Los Angeles, that doctor in Los Angeles that has been building a brand from now on will be at a much better position to compete with the rest of them.
Really fascinating. And I love how you bring the business side and the entrepreneurial side to medicine, because how so many physicians come out of medical school and maybe they don't open a practice right away, but I don't feel like they're prepared to be a business owner. And
no, we're not.
What they're thinking of, right? So kind of connecting these dots, and I see it opening up a lot of opportunity for underserved areas as well. People who couldn't get to a specialist or a physician in the past, and hours to drive. In the United States, we have huge swaths of area that have very little medical care or very poor medical care. And I see this as a phenomenal opportunity.
If you're seeing this happen in the United States, what do you think is the case in places like India and Southeast Asia and Latin America? There's so many people that simply don't have access to a doctor, so they actually need to be able to use this technology. And who are they going to go seek? Right now, you're going to be a doctor who's able to develop a brand, and now you're going to be able to get medical tourism from all over the world just via the internet.
Oh, this is fascinating. If you'd like to continue this conversation with Dr. E, if you're a physician that needs to change direction or get on the bandwagon while it's hot, right? Check out the link below just for us, pgf.me/momentum. Thank you so much for joining me here, and it's been a pleasure.